Namaste, this is Dr. Satyam for the tutorials of In Yoga teacher training. So we are going to talk about physiology of In Yoga. How does In Yoga functions and in what conditions In Yoga can be very beneficial, physiology, right? And it's very interesting for all of us to learn that how it is going to be beneficial for us, because ultimately we are doing In Yoga for restorative conditions. We want our body to get better and better with time, right? So let's understand how in yoga functions and in better conditions, how we can really help ourselves with the help of in yoga, right? So let me share my screen with you to understand the physiology of in yoga and how does it functions in different body parts in a different way, and how our asanas can benefit us in a long run, right? So let's see the slides now here. So physiology of in yoga, how the in yoga benefits. So what we see and what we understand in day-to-day life is, with the help of in yoga, we are actually fighting with the contractures. Day to day, we walk, we run, we jump, we sit, we stand. We are creating unknowingly some minor injuries. And these minor injuries leads to contractures. We are aging. We all know that when we were 22 or 24 years old, our height was 175 centimeter or 179 centimeters or 172 centimeter, whatever. And as we reach to the age of 40, 45, from 175, the height becomes 172. From 172, the height becomes 169. So we have become shorter. So when we say that we became shorter, which means that there is a degeneration which is happening between the bones, and this is a fact. When this degeneration is happening, we are also getting fixation in the joints. So unknowingly, what we are trying to do with the help of in yoga, we are trying to overcome from these conditions. Contractures where frozen shoulder can be seen, cast can be put, immobilization has been done, and with this immobilization or cast or frozen shoulder syndrome or tennis elbow syndrome, what happens is our body, which has got micro tears in our ligaments, they start creating shortness. We call this shortness, which is called as atrophy. And if we want to really overcome from this atrophy, we need to work in elongating these tissues rather than the shortening of the tissue. And to elongate these tissues, what do we need? We need in yoga practices. Degeneration is happening. As I said, we are getting shorter. So this shortening is nothing else but the degeneration. The density of the bone is becoming lesser, the cartilage is becoming thinner, osteoporosis is happening. So with the help of yoga, with the help of in yoga, we make a lot of blood supply to be rushed towards the joint, and we hold the pose. We hold it for 2, 3, 4, 5 minutes. With the help of bolster, with the help of blocks, we are consistently holding the pose. So when we say that we are holding the pose, what is exactly happening here is, with the holding of the poses for longer time, the blood rushes, the minerals reach to the joints, and because of the reaching of these minerals to the joint, what happens? Ultimately, the tissues get revitalized. I'm not trying to say that only in yoga will help. In yoga also helps, but in yoga is creating more stability. People hear sounds from their joints, click, clack, click, clack, clack, when they move the joints, which may not be related with the pain. Right? So there is a sound. Some people, they find there is a sound, but there is slight amount of aches and pain here and there. And the third condition where people say that it is not just aches and pain, it is really painful, extremely painful, which decreases the mobility condition as well. So we need to understand that what exactly is this happening. this fixation, this sound, So we are aging, and as we age, the between the joints, the liquid starts becoming lesser day by day. And as the liquid starts becoming lesser day by day, the two parts of our bone, they start rubbing each other. Initially, not really so frequently, but it is rubbing, and that situation is called as friction. And finally, they starts getting stick to each other, which is fixation. And in that condition, the wear and tear becomes very, very high. So this lubrication which we are talking about, it can be increased by the muscle tissue fluid, the plasma fluid, and this plasma is a part of our blood cells, our blood component. So when blood rushes to any part of the body, the plasma also comes along with that, and this plasma along with tissue fluid start increasing the lubrication. So with the help of in yoga, we are actually trying to hold the poses. Repeat, in yoga looks quite lazy yoga, but in one way we are actually holding the poses along with the bolsters, blocks, and other equipments, so that we can increase the lubrication, decrease the pressure, and we can prevent the fusion of the joints. There are some common issues which are happening, and we can work with the help of in yoga in these common issues, which are there in the knee, which are there in the hip, which are happening at the lower back. So with the help of in yoga, with the help of physiology of in yoga, we are actually trying to address these issues, which will be very beneficial, right? So with the help of fixations, with the help of removal of fixations, we are actually able to work on these structures. Like when we talk about knee issues, what happens in knee issues? There will be tear in the ligaments, there will be tear in the cartilage, arthritis, torn meniscus. These are common knee issues which many people talk about that today, right? So question is, can all the issues be taken care by the help of yoga or in yoga? Answer is no. Not everything can be taken care by yoga. We need to know also where is our limitation. As a yoga teacher, we are not trying to claim that we are a surgeon, we are a doctor, but we are trying to facilitate and complement the existing treatments with the help of yoga. So we need to also know that where to withdraw ourselves, that, oh, this is not my case. So when we look into the X-ray or MRI reports, where it is showing or told that where is the meniscus tear. If you can see here, there is a normal meniscus also here, and you can also see different level of tears. You can see the normal meniscus, you can see the longitudinal tear, which is on the outer side. You can see the bucket handle tear, which is on the inner side. You can see the flap tear, which is also in the inner side, but some flap showing out. Transverse tear, which is broken from the center. Torn horn, which is on one corner. So when we understand here that with the help of yoga, you can work on the longitudinal tear, you can work on the bucket handle tear, and to some extent flap, to some extent. If it is extremely painful, then there also cannot. But bucket handle and longitudinal tear, of course, you can work with the help of yoga. But when it is about transverse and torn horn, therapy can work, but yoga, no. So we need to understand, a good teacher is not only the one who is working the clients and taking care of their health, but a good yoga teacher is also that teacher who knows where to withdraw, that beyond this I cannot do anything. So meniscus tear as a flap, torn horn, and transverse, that is the condition which has to go to for the medical and conventional treatment. We can still complement, but we cannot take care of these things alone. So why the meniscus issue happens? One thing is having a meniscus issue, and one thing is why a person is prone towards meniscus issue. Because the hips are tight, the external rotation is happening without any control. When we are doing knee bend practices, we are creating a lot of pressure because of the tight hips. So we need to open this hip straddle pose, saddle pose, dragon, wing dragon. There are a lot of poses on which we work on the hip opening. So if we don't understand this and we see that the pain is severe and continuous, we need to stop it because the surgery may be required in that condition. But if we see that the pain is minor and manageable, we can live with that. Then in that case, even though it is a minor tear, we can live with it. So it is subjective also at one point of time. Right? So we need to understand our hips, we need to understand our body also, where we decide that how much we can do by a lot of hip opening posture, how many practices we can do by living on the floor like shoelace pose, swan, dragon, winged dragon, square pose, and many other poses along with that. So altogether, in yoga is really beneficial for the meniscus issue, but we need to understand what is that level subjectively. What happens is, which makes the new cartilaginous tissues are none other than chondrocytes. Fibroblast makes new ligament. So with the help of practices like straddle, saddle, we are stimulating fibroblasts and chondrocytes. And ultimately, with the help of collagen fibers, these things can be made. It is not that cartilage cannot be repaired or regenerated, although it is scientifically proven that it happens very slowly. It is not very easy to be made, but it doesn't mean that it can never be made. That's a difference. So yang yoga is a lot about rubbing and utilizing it. So we have a lot of wear and tear. But when we talk about yin yoga, we are actually not doing wear and tear, but we are really working on that state where to the level of osteoarthritis also we can tend to work. There are some hip problems also where people ultimately they may also go for hip replacement surgery also, and then after that when they come for the normal day-to-day life action, they find that their range of motion has become slow, lesser. They are not able to do enough rotation. So in that condition also they ask that, can I still do yin yoga? And answer is yes, you can still do yin yoga. Yin yoga is not only before surgery, but it can be also done for the sake of rehabilitation also. Practices like winged dragon, square, easy saddle pose, all these deer pose from which actually we should begin the entire practices. So that is very helpful. Internal and external rotation of the hips are quite helpful. Most important thing as a teacher, what we have to see here is, if there is a compression, don't go ahead with the compression. But if the tension is there, pull. In that, you can work more longer. So compression, you don't work. Compression is like this. Compression is like this. Tension is like this. So you can work on the tension. Okay. So after this hip, we understand that there are other issues which are lower back disorders, on which also yin yoga can do its job nicely. We have different kind of problems in the lower back, like herniated disc, slip disc, bulge disc, thinning of the disc, even arthritis of the spine, where osteophytes can be seen. So in all these conditions, we can have radiating pain, back pain, stiffness. The first formula what has to be followed by any yoga teacher is flexion, the forward bend, acute forward bend, we should say acute forward bend, and flexion of the spine should not be done. Forward bending should not be done. Or it should be done only to the limit of not more than 90-degree angle from the legs. From the femur, from the legs, from the hip, not more than 90-degree action. Try to avoid that also. But if the maximum should be done, it should be done up to 90 degrees. So avoid flexion of the spine, forward bends, forward folds, forward bends, especially the acute ones. This increases the disc bulge. This hits the nerves, which creates inflammation of the nerve and may stop yoga with your client for longer time. So please be careful about that. Instead, work on flexion of the hips. Flex the hips, but not the backbone. Flex the hips, but not the backbone. Try to keep the spine straight as much as you can. It's not only just straight, stretch. Create the stretch between the two spinal bones. Don't twist it. Don't twist it. Don't create twist. You know, stretch and flexion of the hip is good. You know, Phoenix pose, which are very good for the bulging disc as well. Crocodile, balancing cat, and many other practices are also good. Altogether, something which is very important is we need to understand the neutral position on which the pain is lessened. The forward and backward bends are a little bit restricted. Back bend to some extent you can also do, not really a big problem for the back bend. Only with special patients who do complain that when they are doing back bend, then also they have problems. Then you have to be worried about them. Otherwise, 60 to 80% of people, they don't have problem with the back bend. Only 20% of people to 25% people, they have problem with the back bend. So in that case, don't over push. Avoid flexion of the spine, forward bend of the spine, totally avoid. Work on planks, side planks, crocodile, and try to develop that neutral pose by which you can really help the client nicely. So with this chapter of physiology of yoga, you have understood that one side how you can safely work on the joints. On the other side, how you can work on bulge disc also, how you can work on back pain also, how you can work on the knee pain also, how you can work after the surgery of hip replacement also, and how you can improve the quality of your chondrocytes, cartilage, collagen fibers, how you can overcome from the contractures, etc. So in yoga is not just a yoga for doing exercise or for sweating or just for stretching, but in yoga is beyond that. In yoga has health benefits, and we are very fortunate that we have this yoga today in our lifestyle. Please keep practicing in yoga regularly under the guidance of teacher and masters and doctors. Thank you very much for watching this tutorial and learning this tutorial. We will come with the next chapter soon in the next video. Thank you very much.